Hello and welcome to my channel. My name is Jazzy RN. If you're new here, welcome. If you're not new here, welcome back. The goal of my channel is to help nurses pivot from the bedside to remote work. Advocate Healthcare is hiring a care transitions nurse for the weekends. This job is part-time. You'll work 20 hours per week and the pay is $35.50 to $53.25. I always go straight to the qualifications. Even if you don't meet every single preferred qualification, I still suggest you apply. This job is fully remote. High-speed internet is required. You'll work from 0800 to 1830 hours and will include holiday and is every weekend. Illinois and Wisconsin RN license is required. They require a BSN in nursing, typically 2 years experience in nursing in an acute care or community setting with an emphasis on palliative care or senior services, excellent written and verbal communication skills, strong organizational, analytical, and problem solving skills, ability to educate clinical staff and the community, ability to work well with physicians and other healthcare professionals, ability to work in a team based, multidisciplinary environment, RN license issued by the state in which the team member practices. I do want to mention right here as a disclaimer, may need to operate a motorized vehicle to facilitate home visits as appropriate. If you are fortunate enough to get an interview for this job, I would ask about these home visits. Spectrum Healthcare Resources is hiring for an RN Utilization Management. This job is working weekdays, 8 hours per day. You'll be working remotely. They require a BSN in nursing, at least one active state nurse license, preferably compact state licensure, 2 years working as a RNUM, preferably in a remote or hybrid environment. They want you to possess either certification, that could be a certified professional utilization review or a certified case manager, or the other option is 2 years of full-time broad-based RN experience in utilization management review or a case management setting with the preceding 5 years. Notwithstanding aforementioned experience requirements, the HCWs must have pertinent clinical experience within the past 2 years, sufficient to demonstrate current clinical competency for the setting and procedures required by this contract, highly organized, self-directed worker, able to function in a high volume environment without distractions, strong verbal and written communication skills, proficient level of experience with Microsoft Office applications, and strong tech aptitude. I do want to point out here, make sure you add platforms to your resume. That includes Microsoft Office, if you know Epic, Cerner, Meditech, ProTouch, etc. All the platforms and software you use at your current job and what you use at your previous jobs, add that to your resume to make your resume more tech savvy. And you must have access to secure high-speed internet. And just a FYI for this job, the recruiter's name is Joseph Day. This is his direct phone number, 314-744-4138. And here is his email address. This is very rare to see the name, number, and email address to the hiring person. CVS is hiring a telehealth RN. This job is weekdays from 10:30 a.m. to 7 p.m. Central Standard Time. These are set hours, and this is a full-time hourly position. They require an RN with unrestricted current compact license for the state of Arizona and the ability to be licensed in additional states. RN must hold an unrestricted license in their state of residence with multi-state or compact privileges and have the ability to be licensed in all non-compact states, territories, and the District of Columbia based on the needs of the business. Many licensing bodies have their own specific state requirements. RN with an unrestricted current compact license in Texas or Arizona and the ability to be licensed in multiple states. Candidate must also be based in Texas or Arizona for this job, 3+ years of clinical RN experience, experience using Microsoft Office, including Word, Excel, Outlook. Preferred qualifications include previous telephonic nurse experience, Epic system experience. BSN is preferred. This is not required. Licensure in multiple states is preferred. They do require you to have an RN diploma, associates, and once again, the BSN in nursing is preferred. SCAN is hiring for a care manager LVN. This job is full-time for California nurses. You must have a California LVN license. This is required. Clinical nursing experience, 2 to 4 years. experience in care or utilization management, 2+ years, 5+ years experience in healthcare, medical management, change management, and or leadership, ability to communicate effectively verbally and in writing, highly organized with attention to detail, resourceful problem solver, ability to work with all levels of staff within the external to organization to achieve goals, strong organizational skills, ability to multitask, and to appropriately maintain confidentiality. And the salary for this job is $34.47 to $55.14 per hour. Confluence Health is hiring a nurse clinical documentation RN. This job is full-time. Your salary will be between $41.29 to $64.61. You must reside in the state of Washington, Oregon, Idaho, Wisconsin, Florida, Montana, Texas, Arizona, Virginia, Alabama, or Tennessee. You must have 2 years acute care experience, preferably ICU, PCU, or strong med surge. Current licensure in the state of Washington or licensure through multi-state nurse licensure compact. Must successfully pass an online clinical knowledge assessment test with the passing rate of 70% or greater, extensive knowledge in pathophysiology, disease processes, and associated care pathways, basic computer skills, familiarity with Microsoft software programs. They desire, but is not required, a BSN, 5 years acute experience in organizational, analytical, and writing skills, ACDIS or other CDI certification, and knowledge of CMS and regulatory environment. Oceans Healthcare is hiring a regional utilization review coordinator. This job is full-time. They require a bachelor's degree or higher in social services or related field or licensed nurse, at least 4 years utilization management experience in a psychiatric or chemical dependency acute inpatient setting. You must have excellent assertive communication skills, knowledge and in-depth understanding of psych, CD treatment, and discharge planning, must demonstrate strong patient advocacy skills, must be able to organize and prioritize high volume workload, must have working knowledge of Outlook, Excel, Word, and other office platforms, must be able to function with minimal supervision, must successfully complete CPR certification and an OCEANS approved behavioral health de-escalation program. Therapeutic intervention de-escalation education is required. Cigna is hiring a case management senior analyst, Allegiance, work at home. This job is full-time. Requirements are an active RN license with a associate's degree in nursing or higher. Compact license is required, at least 3 years of clinical practice experience, strong skills in care planning, care coordination, and patient advocacy across the continuum of care, clear, respectful communication, written and verbal, with members, families, providers, and business partners, comfort using a PC and common tools, that's Windows and Word, and ability to learn new systems as they change. The next job is a nurse case management manager, Evernorth Health Services. This job is full-time. You must have an active unrestricted RN license in a U.S. state or territory, 2 years full-time equivalent direct clinical care experience. If directly supervising the case management process for 3 years, holds a URAC recognized case management certification. Cooper University Healthcare is hiring a clinical documentation educator PRN. A BSN is preferred. Associate's degree in nursing or other relevant associate's degrees are considered. Proficiency in Microsoft Office applications needed. Word, PowerPoint, Outlook, and Excel. Confident and professional public speaker with exemplary verbal and written communication skills. Well-versed in using, referring to, and researching CMS and other federal and local clinical documentation compliance guidelines, CPT, ICD-9, CM, and HCPCS codes, evaluation and management documentation guidelines, and PATH guidelines. Blue Cross Blue Shield of Tennessee is hiring a clinical outreach specialist. This is for LPNs. This job is full-time. You have until May 19th to apply for this job. You must have an active unrestricted LPN license, 2 years experience in patient or member education, clinical workup or care coordination, HEDIS experience is preferred, knowledge of HEDIS measures, claims billing guidelines, and health plan standards, familiarity with preventative screening workflows and vendor-supported outreach, strong communication skills with ability to translate clinical concepts into member-friendly language, comfortable working with sensitive health information in high-risk scenarios, ability to explain screening and diagnostic results, associated risks, and follow-up importance in clear, empathetic terms,